Hi everyone and welcome back to my channel. Hope you had an amazing week. My name's Dr. Daniel Follows. I'm a fully qualified GP practicing in the UK and this is GP Made Easy. So today we're going to cover eczema because it's quite a common condition that presents to primary care and can be quite tricky to manage as there are so many different creams and ointments available. So I'm going to hopefully help summarise it for you in this video and make it easier to manage. But before we get into the video, don't forget to like, comment and subscribe. It lets me know that you're enjoying this content. But anyway, let's get on with the video. So, what is eczema? Well, it's commonly known as atopic eczema or atopic dermatitis. Both terms are used interchangeably. So, eczema is a chronic relapsing inflammatory skin disorder that causes a breakdown in the epidermal skin barrier. So it's important to let patients know that it is a relapsing disorder, so they will have flares from time to time. And the main point of management is to try and keep it as much under control as possible. Now, we don't just use dermatitis on its own, as that is a big umbrella term that covers a lot of skin conditions such as atopic eczema, non-atopic eczema, contact dermatitis, whether allergic or irritant, discoid eczema, photosensitive dermatitis, and seborrheic dermatitis. Now, why do we care about eczema so much? Well, it presents in about 20% of children, about 5 to 10% of adults, so it'd be quite a common presentation in primary care. So, how do we diagnose eczema? Well, it's classed as an itchy skin condition with 3 or more of the following criteria. Either a history of itchiness in the skin creases, such as the gaps here of your elbows or behind your knees or at the front of your ankles, or sometimes it can present around the neck, or in children under 4 they can have it on the cheeks. If they have a history of hay fever or asthma, or if it's a child under 4, if they have a family history of it in mum or dad, if they've had general dry skin over the last 1 year, if they have visible flexural eczema in the same place as described before, and if they've had onset within the first 2 years of life. Now, just a note, in darker skin tone individuals, it may not present as redness and cracked skin, but it may present as hyper or hypopigmentation in those areas. So, how do we manage eczema? Well, the first thing is to try and avoid triggers if you can, and some triggers to be aware of are soaps, detergents, skin products, especially those that form a foam, extreme hot and cold temperatures, tight clothing, any clothing that are made out of synthetic materials or wool, and any specific allergens. The next line of treatment is emollients to keep the skin moisturised, and we'll cover that shortly. And then for acute flares, it's the steroid ointments or creams, which we'll cover later on in this video. Now, for those patients that come asking for allergen tests, they're not routinely needed, unless if you did want to have a look in further if you were unsure of an allergen that might be causing the eczema. So, moving on to emollients or the moisturising creams. They come in many different varieties such as ointment, sprays, lotions, cream or gels, and the difference between them is how oily they are, with the creams not having as much oil, the ointments having quite a bit of oil. And in terms of which one is the best to use for patients, it's a little bit of trial and error till you find the one that suits the patient best. And of course there are many different brands available such as Epimax, Aveeno, Double Base, Sertraban, Epiderm, so they're all ones to be aware of. Now, which one to use first? Again, like before, it's a bit of trial and error, but for most areas there are sort of prescribing guidelines of which ones are the sort of cheapest, and most people tend to go for that recommended one first. So for example, in my area there's one called Epimax that's normally recommended first line, and I tend to give the cream. Personal tip of mine, if someone has got quite thick skin, you think they do need that ointment to soften the skin more, to try and get them to be more compliant, I give them a cream for the day and then have them put the ointment on before bed to soak in overnight. Now, how often should they be using it? Well, when someone has a flare of their eczema, they should be applying the cream at least 4 times a day, and when the flare is over, they should be using it at least sort of twice a day. Just to be aware, they can also use them as a soap substitute in the shower. So on average, it's recommended they should be getting through one of the big 500 gram pumps every sort of 2 to 4 weeks. and if they use it as a soap substitute, then they should be needing at least 2 of those big pumps a month. So how should they apply it? Well, it's recommended to not rub it into the skin, but instead just apply it in the direction of the hair growth. So for example, down the arm like that. So moving on to the steroid ointment and creams that you use to treat the acute flare-ups. They come in many different strengths, and so up here I've got a table. I'm going to go through each different one for each strength. So starting off with the mild steroids, we've just got hydrocortisone 1%, and then moving on to the moderate strength steroids, we've got clobetasone and betamethasone 0.025%. And then moving on to the potent steroids, there's betamethasone 0.1%, there's another type of betamethasone 0.025%. Just be careful, look at the second word for each one between the moderate and potent, they're very different. And there's mometasone. And then in the very potent steroids, there is clobetasol. I've left it up in a chart here, as you can see there's a bit of similarity between each different one. So have a look and just make sure you realise what the differences are. So in children with a flare-up, they recommend to use the lowest potency as possible, so they recommend using the mild steroids such as hydrocortisone 1%, and if they need to bump it up because it's not working, they can move up to clobetasone. They recommend that they apply it once a day for about 2 to 3 weeks until it's settled down, and then apply it twice weekly for a short period afterwards. They don't specify, but I would suggest probably about 4 weeks after that. In adults, the strength of steroid that you use just depends on the severity. So if it's mild, use mild strength. If it's moderate, use moderate strength. And if it's severe, use potent steroids. For patients that have hands and feet affected, it's just recommended to go straight in with very potent steroids such as clobetasol, because the hands and feet have an extra layer of skin, so they need stronger steroids to penetrate the skin. Now obviously another big question that can come up is when patients like, so with the moisturiser, do I apply them at the same time or is there a certain time frame? What's recommended is to space it about 20 to 30 minutes apart between applying the steroid and then applying the emollient, and you can do it either way around, so either emollient first then steroid, or steroid first and then emollient. Now this is only a guidance. If you're worried that a patient's not going to be compliant waiting for that time, they can do a shorter time period. So you've decided on the strength steroid you're going to prescribe. Now the big question is, what dose is recommended for each part of the body? Well, the way that we dose steroid ointments is with what's called fingertip units. So just to show you, I've got an example cream here, and one fingertip unit is from, so I've got my finger here, it's just from the end of the tip of the finger to there. So as you can see, that's classed as one fingertip unit, and that has about 0.5 grams of cream. So up here, I'm going to put a chart which shows how many fingertip units you need to cover each part of the body. And as you can see, to cover the whole body, you need about 40 fingertip units, which is about 20 grams of cream. So please take that in mind when you are prescribing for a patient. Please make sure you prescribe the right amount that will cover them for the whole course, so that they are compliant with the treatment and don't have to keep coming back for repeat prescriptions. Special note, if you do have someone who comes to you and they're like, I need someone to settle it quick because I've got an exam or a wedding coming up soon, then the guidance states that you can give them a short course of steroids where you give them 30 milligrams of prednisolone for 1 week and then reduce it by 5 milligrams every week. Now, what if someone comes to you and it looks like they've got an infection? Well, it's recommended that you give them a moisturising cream with an antibacterial such as chlorhexidine to use as a soap substitute till the infection settles. And the one that I've found that contains all of that is the dermal lotion, so prescribe them that to use. They only recommend to give antibiotics if they've got widespread weeping or they're quite unwell with it. Well, that's it for today's video. I hope you found it helpful and learned something new. And as usual, I'll link all the resources for this video in the description down below. Don't forget to like, comment and subscribe. It lets me know that you're enjoying this content, and you'll also keep up to date when the next video comes out. Also, if there are any topics you want me to cover, then please comment down below. I'm also on Instagram, where I post more regularly. It's the same name, GP Made Easy. And I also have an email address which is up here if you need to contact me that way. Well, I hope you guys have an amazing week, and I will see you in the next video.